Hello, I'm Dr. Guy Yatros from Dental Sleep Solutions in DS3. Welcome back to the Dental Sleep Medicine Insider to part 2 of billing. Today we're going to talk about the fourth pillar, as we call it, of dental sleep medicine billing. And last time, as you recall, we talked about out-of-network billing for commercial insurance. This time we're going to talk about a similar subject when we're out-of-network or at least non-participating in Medicare, how we do that. Again, there's certain things you need to file a claim. We have them listed here for you. If you need more details on that, we can certainly help you at DS3 understand that. So let's talk about Medicare for a moment. Medicare is federal health insurance for the retired and disabled. So part of your check each month likely goes towards Medicare. It's not Medicaid. Medicaid is welfare that's state run. So of our patients who have Medicare, the good news is they do cover dental devices as of a few years ago. And there's 4 regions throughout the country. I don't have them listed here because they changed their allowable amounts, so I don't want to lock us into a fee there. But each region has an allowable amount, and Medicare will pay 80% for the dental device for that allowable amount, and then the patient's responsible for 20% of that allowable amount. But the good news is most patients have what we call supplemental insurance, and then that supplemental insurance covers the other 20%. So in Medicare, there's really 3 options. You can opt out as a dentist, and by the way, you didn't have to do anything with this prior to beginning treating patients with dental devices. This is Medicare, it's DME, so it's different than other parts of Medicare. So you can opt out, which means I just don't want to have anything to do with Medicare. We're going to see our patients, and the patients get no Medicare benefit, and that requires paperwork and time as well. You can become a participating provider, and this requires you filling out an application. And when you participate, you're saying, I accept Medicare's amounts in full, and the patient, if they have supplemental insurance, I accept their supplemental insurance, and that allowable amount that will be for your particular, what we call LCD, is all you're going to collect. You can't balance bill the patient. Now, what we typically recommend is our dental sleep providers become what we call non-participating Medicare providers. And what we do here is once you fill out the paperwork, and there's a little bit of time involved in doing that, you can bill Medicare for the patient. The patient can pay you directly, and then the Medicare checks can go right to the patient as well as their supplemental checks, and you can bill the patient your normal fee if the Medicare is less. So the other real advantage to this is once you're a non-participating provider, you can participate on a case-by-case basis. There's a little box called Accept Assignment of Benefits on the 1500 form, and once you're a non-participating provider, if you don't check that box, then you are basically a non-participating provider on that particular patient. The checks are going to go to the patient, and you can bill the patient whatever your normal fee is. If you decide you want to help that patient out, you can, and for whatever reason, and they can't afford any out-of-pocket, you can accept assignment of benefits. Now the checks are going to come to you, and at the same time, you cannot balance bill the patient. So by becoming a non-participating Medicare provider, you can kind of go back and forth between being participating and non-participating. There are some rules that go along with Medicare. They're listed here on your screen, that certain guidelines you have to follow. The apnea has to be a certain level, and you can read these yourself or review them, and we'll be happy to get those to you if you have questions here at DS3. You also have to use Medicare approved devices, and you also need to fill out some paperwork for your Medicare patients once you get this Medicare approval. It's called an advanced beneficiary form, and some other paperwork that you need to deliver with your Medicare patients. Here's where you go to get your Medicare application if you haven't already done that. And again, the purpose of this is really to kind of go through that quickly and then talk to you. Once you get your Medicare non-participating approval, how do we do this? How do we do this in our office? And so here's the flow sheet we have for this one. For Medicare patients, before we see our patients, we have to establish our cash fee. We talked about this last time. If you're not familiar about how to calculate your cash fee, there's also a link on this page where you can see a previous video on how we establish our cash fee. We need to see the minimal fee that we really want to make us happy. So cash fee is really what I want to do, but we have a fee below that where we still make a profit that we're willing to reduce our fees to help a patient out. We need to know what the Medicare allowable amount is, and then we need to calculate what we call the maximum out-of-pocket or the MOP. So let's take an example similar to what we did in our last episode of Dental Sleep Medicine Insider. If we have a cash fee of around $2,500, that's what we established, and our minimal fee is $1,500. What that minimal fee is how much we really need to still make a profit, but we'd rather take that than someone walk out the door, especially if we're helping someone. In my area today, and again, don't write this down because this you may be viewing this a year from now, the Medicare allowable amount's just a little under 1,070. So that's how much they allow here in my area where I practice. So the maximum out of pocket is your cash fee minus your Medicare allowable amount. So you just take the 2,500 minus the 1,070. It's 1,430. I would just round that up if this was my practice to 1,500 just to make it a number that's easy to remember, or 1,450 or something like that. Now understand, if the patient does not have supplemental insurance, then they're responsible for 20%, the other 20%. Most patients do have supplemental insurance, but if not, you got to make sure you add that back in. So let's see how we do this. This is actually much easier than out-of-network billing. With our Medicare patients, they come in, we know they have Medicare, we let them know what our cash fee is. So our cash fee is, in this scenario, $2,500, and we know you're going to get a little over $1,000 back from both your Medicare and your supplemental insurance check. So I can say to my patient, Mr. Patient, the maximum out of pocket you're going to have to be out is $1,500, a little less than $1,500. Does that sound okay? If they say yes, we go ahead and schedule them. We go ahead and treat them. They're going to get, we're going to collect our money, our deposit from them, and the final payment, and then the checks are going to go to the patient. Now we do need to follow up afterwards, because sometimes if we do make some concessions, the Medicare supplemental insurance will actually sometimes pay more than a Medicare allowable amount. So we always kind of follow through to make sure, because if they do, of course, that's the money that should be coming to us. Now, if we tell the Medicare patient that, look, they're coming in, the good news is you've got Medicare. The good news is they cover this these days. The way it works in Medicare, these checks go to you most of the time. Our fee for this is whatever your cash fee is. And in this scenario, $2,500. You're going to get a little over $1,000 back, and it's going to be around $1,500 or less out of pocket. They say, I can't afford that. Well, we could say, well, we can make payments. Well, no, it's not it. I just can't afford it. We could reduce it down to, in my case, or in this case, in this scenario, the $1,500, the minimal fee. So you know what? We can do it with $500 out of pocket or less for you. Again, that's because we reduce that down, or maybe you go somewhere in between. Again, if I want to help this patient, it's a little different than dentistry. This person may really need our help, and I know I'm still making a profit at that, even though it's not the profit that I maybe ideally want. So if they agree to the $500 out of pocket in this scenario, we go ahead and schedule them just like we did before. And again, I want to do this for two reasons. One is to help the patient out. And again, it is still profitable if you have that minimal fee figured out. Now let's say the patient comes in, they're desperate, they have a ton of medical bills, and they just can't afford any out of pocket. Now we can make one of two choices. We can accept the assignment of benefits. So here where I practice today, that would mean I get two checks, one from the Medicare, one from their supplemental, assuming they have supplemental, and it's going to total around $1,070. So if I'm willing to do that for that patient, now I just check that box. The checks both come to me. We go ahead and schedule them. If we're not willing to do that, then we tell the patient we can't help them out, and of course we don't go for treatment. So as you can see with Medicare, through these different paths, it's rare that I don't get a patient to say yes to treatment, because we're able to work with them based on their ability to pay and their need. The more severe their apnea is, the more that they've tried other treatments and they don't have solutions, the more likely I am to make concessions to try to help that patient out. The other reason we might make concessions and accept the assignment of benefits is also for new referrals, to make sure that those patients go smoothly. So hopefully that's been beneficial between this episode, and if you didn't catch last month's, check out the last month's episode on out-of-network billing. And this should make your processes better as you bill patients and get more patients treated with their airway problems. So thanks a lot for tuning in to Dental Sleep Medicine Insider. Again, got Dr. Guy Yatros from Dental Sleep Solutions in DS3. We'll hopefully have something very exciting to talk to you again about next month.